Good morning, and thank you very much for your attention and also for attending this fantastic conference, which has provided me with a wealth of information already. Before I start, I still also would like to acknowledge the Turrbal and Yagara people, who are the traditional custodians of this land, and I would like to pay my respects to the elders, both past and present. This morning, I will be discussing a project that I had the good fortune of working on, along with Meg Perrier, a primary health nurse from CoHealth. The project that we delivered was called Hep B 123, so Teach, Test and Take Control. The ambitions of the project were to provide education and awareness to refugee and migrant populations at risk of hepatitis B, empowering them with the knowledge, equipping them to undergo testing, and to hopefully, with this empowerment and knowledge, take control of their lives in relation to the hepatitis B outcomes. We delivered the project through both education sessions and an outreach clinic that provided hepatitis B testing, referral and immunisation. So, why is hepatitis B so important in our communities? There are some brief stats up there, and I'm just going to move you to the map. So as we can see, Australia is, if you can read the writing, and I'll get it into presenter view. Should be fine. So as you can see on the map, Australia is classified as a low endemic country. However, the majority of our newly arrived people, refugees, asylum seekers, and migrants come from high hepatitis B endemic regions. So that in turn also reflects that we've got about 1% of our population, which still equates to nearly 240,000 people who are infected with hepatitis B. So if you are in your clinics and you see a lot of people who are from the countries that are coloured in the dark green and the green colours, you might think to yourself, have they been tested for hepatitis B? And have they been put on a catch-up program, or are they vaccinated? Just briefly, a quick overview is that hepatitis B is a blood-borne virus, so it's primarily spread through sexual transmission and vertical transmission through mother to child. The populations primarily in Australia are people who are impacted by hepatitis B, are people who inject drugs, Indigenous people, men who have sex with men, and quite often inmates of correctional facilities. But it is strong to emphasise that this is a vaccine-preventable disease, so we can stop it in its tracks. In Australia, we have universal childhood immunisation schedule that has included hepatitis B since 2000. So as a result, we still have some catch-up programs. Okay, so this is the chronic hepatitis B cascade of care, which some of you may have come across, and this might be some new information for you too. So we've got the population who are living with chronic hepatitis B infection, and we've got those who are diagnosed and those who aren't diagnosed. As we know, hepatitis B can quite often be asymptomatic, so there'll be people living within the populations that don't know that they've got it. And as we scale down, we can see that we've only got a very small portion who are engaged in care. So it's tough to reach these groups. Providing immunisation is one step, but as you can see, we've still got a really long way to go. So this is where our project comes in. The aims of hepatitis B 123 were to increase the awareness and understanding of hepatitis B and encourage testing and vaccination in cold communities, in particular at the school where we were taking this clinic to, which taught the Australian Migrant English Program studies. If anybody's aware of that, there's 510 hours offered to newly arrived migrants, people who have just received their permanent residency, to undergo further English education. And as we know, testing prior to immunisation is clinical best practice, but it also enables us to identify any acute chronic hepatitis B cases and refer into care. So just going back to that cascade of healthcare for chronic Hep B. So the key objectives we had were to establish a working relationship with involved agencies, provide cultural appropriate education sessions to increase the health literacy and raise awareness of hepatitis B, deliver culturally responsive outreach service that provides the Wingate Avenue community with safe, accessible and practical hepatitis B testing, vaccination and or support. We also, our key objective was to offer culturally appropriate support networks to assist individuals who were diagnosed with chronic Hep B or had family members and wanted to seek further assistance. And also to finally investigate findings to evaluate the acceptance and relevance and sustainability of having an outreach project. So as going back to the map before, the primary populations that we wanted to target were people who were born overseas from green, dark green and light green regions. To deliver this project successfully, we need to engage with the local community AMEP provider, which was Wingate Avenue, and also Co-Health to assist with providing the clinical outreach. Understanding that our Australian health system can be quite challenging for people whose primary language is not English or whose levels of health literacy are low for various reasons of underdeveloped health and education systems from their home countries and instability. So we concluded that an outreach clinic might be best to bridge and try and maintain these people coming through, going for testing, well, first up going for education and then going through testing, and then hopefully engaging them with all 3 vaccinations, because you can quite often see that high drop-off. So we developed a little student booklet, and we also had a GP intervention postcard, which I can show you just briefly if you wanted to see. And everything that was, the content was that was going into this education was keeping in mind that there is a national hepatitis B testing policy out there and it's best to adhere to it. And we were wanting to build education and understanding that would equip the students who wish to be tested to then, you know, garner them with the knowledge to undergo a proper informed consent. So we delivered 7 45-minute, we kept it brief, 45-minute education sessions, and they were comprised of a PowerPoint and the education booklet, as well as the postcards. The education booklet was also developed in collaboration with the teachers of the AMEP program, so they have an understanding of the level of literacy of the classes that we would be trying to engage with. So we're working with educators, and then we had our power as health professionals to try and put it together to best equip the students. So we ended up delivering the sessions to roughly 110 students. We also conducted expressions of interest for the outreach clinic as a bit of a litmus test to see whether or not it was, they understood it and it was approachable to them. And about nearly 60% of the students were interested, which is a good indicator that, you know, some education was coming across in a way that they could interpret it. But also we had to respect that reasons for not participating included preferring their own GP, and some people were established within their own health care, so they had their GP that they preferred to go to. And then there were also some who had also had their vaccinations. So there are great GPs and practice nurses out there who are already, you know, light bulbs going off saying that they're coming from high endemic regions, we should test them, and they've probably been vaccinated. So here comes the exciting bit, which is the outreach clinic, which was fantastic. So we did the education session a week prior to the outreach clinic to try and keep it fresh, have them still hold on to as much information as possible, and then move them through to the next step of speaking to, I've got to really hurry up, speaking to GPs. So also the initial interest jumped from 60 to 73%. So we had a team, and Ambi is in the pink top there. And as you can see, they're who we needed, and we saw over 80 students, and we conducted 78 tests. And as the results show, we indicated around 77%, not 70%, identified as having chronic Hep B and moved to engage them in care. We had 47% who were non-immune, and we also had 46 who were immune. But the interest is in, I think, below there, which is 70% were immune due to resolved infection, indicating that populations are still being exposed to this. And 30% immune due to vaccination. So, I mean, that number is probably rising. We don't really have consistent rates in terms of what we're expecting people to be, adults are meant to be vaccinated. But I think that that's still quite good for newly arrived migrants. We then had our immunisation clinic, which was really high for the first one. So we got nearly 90% immunised. Our second one, a little bit lower, coming just off Easter. So kind of thinking about, we've got 3 vaccines to deliver. We've got to work within a school term. We've got to work within religious holidays. How are we going to do this? So, I mean, that's low, but we've provided them with appointments at CoHealth too. And we've got our 3rd immunisation to come, which will be after Ramadan. So I guess the keys here is innovation, and it's thinking outside of clinical walls and practices. But what kind of brings together the innovation, we've got to think about budget, collaboration, communities and sustainability. So with our budget, we achieved funding through GlaxoSmithKline, who are the manufacturers of the Endrix immunisation. But there's also some great thought for how you might be able to get it as primary care nurses, in thinking that whether or not to investigate pharmaceutical company grants like the one that was mentioned this morning, and also feel out within your networks to see if there's anybody else interested, or if anybody else has previously gone down that pathway, to pull a template to cut and paste with anything that you might wish to do. Other ideas for where to find grants is to register for PHN, the Primary Health Network mail-outs. They do have some money that they like to spread. And if you have an interest in a particular field, I mean, viral hepatitis is always looking for champions, link in with the community health organisations working in that area. So I'm from Hepatitis Victoria, and we naturally partnered with CoHealth. But there's also Hepatitis Queensland, and they've been doing some fantastic work in the Hep C space and a combi van and outreach. Always remember that 2 are better than 1, so try and find people to support you, and also become a member of Alliance or strategic reference groups, because they will give you some more ideas. Big costs are obviously the clinical supplies. Low costs were the resources, where if you're collaborating, leading on to this slide, you know, our resources at Hepatitis Victoria partnered with the resources from CoHealth worked well. Interagency collaboration is a fantastic source of shared ideas, experience and knowledge, allows for foundations of future work, extends reach and mobilisation, and it also provides a more comprehensive approach. So we were equipping these students with a greater understanding of what hepatitis B was before they went to get a test, and they could also go and speak to it with their family members in the community at home. Focusing on communities, to work with and within the communities, if you have the migrant groups, to try and engage with them and work alongside and find out what works for them. It encourages autonomy, fosters empowerment, and raises awareness, and encourages peer education, which is another strong element of doing outreach and education, is wanting to get people to then talk to others. So I apologise, I'm speeding through it, but this is the last bit. So where to now? Perform an evaluation, build upon learnings and new beginnings. Evaluation, always built into program, formative and summative. And this may be a bit abstract, but it really provides you with the look back to see where things could improve and where you could maybe pull back and stop. Stakeholder surveys, know if your collaborators are working along the same pathway or whether or not they're happy with what you're doing or you're happy with what they're doing. And also think about the outcomes. Yeah, sure, we've gotten some people vaccinated, but what are the long-term social impacts? Are we going to see them bringing their children and making sure that their children are tested, their partners are tested, their mothers are tested? And also contribute to the pool of knowledge. It's valuable what you experience in the field, and then through evaluation and building it all together, your insights are incredibly valuable. Learnings, yep. So success, definitely in some aspects. I think vaccination is the biggest one, but also community education and awareness for community mobilisation and interagency collaboration is a big win. Challenges were the global shortage, which we really needed to realise. Pathology, due to privatisation, some companies will try to make money and ask, to compensate for a lot of tests that are covered by MBS, and realistically we shouldn't be paying for it, nor should the patients. Health literacy, hence the education, and also school timeframes. So it's thinking about whether or not school is an appropriate place, or maybe we should think about factories and how we're reaching these communities. So yeah, new beginnings. Building from the evaluations, should we identify alternative locations, factories, places of worship, or your own local GP clinic, working in collaboration with a school to have a clear avenue for getting students in to get tested, and also determining the level of care, how flexible we need to be. Will we provide them with just tests, or will we take them through the full course of vaccination? I feel like this has been quite fast, but I'm sure it's a little bit overwhelmed. That sums it up. I would just like to say thank you to APNA for providing me with the ability to give some insight with the project that I've been working on, which has been in collaboration with a really strong primary healthcare team and the GPs and the practice nurses, the nurse immunisators. They've been fantastic. Wingate has also been fantastic, and we've had a lot of volunteers come on board too. So there we go.